Good evening, coaches. My name is Soumya, and I'm a holistic nutritionist coach. Today, I'm going to discuss a case study about Lichen Planus and how these holistic tools have helped the client to come out of this condition. Okay. Especially the tools which we have implemented are breathwork and affirmations. Okay. We will see how these two tools work in her condition. All right. So we will get into the client details. So the client happens to be a 30-year-old woman, married, and she is blessed with a baby boy. And she is a small-time investor. And she comes with a condition of lichen planus of skin. Along with that, she was also having anxiety, depression, and insomnia. Okay. For her condition, she was using some topical steroid creams for the skin rash and everything. And for anxiety and sleeplessness, she was using some Ayurvedic medications. Because for her skin condition, whatever the medication she was using, they were also having some side effects. So she didn't want to use them. All right. So when we get to know about her condition, more about the condition, we came to know that it is a chronic inflammatory condition. It affects the skin, hair, and nails, as well as the mucous membranes, especially the oral cavity, the genital organs, as well as the nasal cavity. Okay, so how does the symptoms appear? Usually, the client or the person would have a flat, purple itchy lesions on the skin that would be seen on the back of the arms, legs, in the palms, in these areas. And what are the causes? Okay, causative factors could be hepatitis C infection, any recent vaccination, or the long-term use of non-steroidal anti-inflammatory drugs. That could be one reason. And certain medications used in hypertension condition. And stress is also major contributing factor for this condition, right? So the conventional treatments which are available are like immune suppressive drugs and antihistamines to control the allergic reactions. Okay. So when we looked into the key areas of her life, okay, so we came to know that she was also having the same similar kind of symptoms. Okay, the lesions were there on her arms as well as the back of her body, and she was also having the lesions on her lips also. Okay, and her nails were so badly damaged that the nail bed itself got opened up, and the nails have developed, deep ridges kind of a thing. It was easily become the nails have become very soft. Such was her condition. Okay, and she was also very concerned about her looks. She cannot go out, meet people, talk to people openly. So that was the condition. So looking into her work-life balance, she, as I told you, that she was an investor, so she wasn't going anywhere out much. So a lack of social interaction is also, keeping her thoughts to herself. And they have seen some financial instability as they have invested some amount in, the stock market and everything. So they have seen some up and downs in that area. So that was also bothering her. So coming to the emotional and mental health, she was complaining that, since morning, the moment she gets up in the morning until the time she hits the bed, she continuously had some negative thoughts running in her mind. Okay, there was no break at all. She told me, though I'm surrounded by so many people around, still I'm if I'm talking to somebody also, back of my mind, there are so many thoughts running. My mind has become my biggest enemy and I can't run away from it. So that was her situation. And she always had a fear of being alone. She always wanted people to be around with her. And at the same time, she was also having trust issues as well. So I have asked her, what is it, bothering you so much? So, this condition has started during the second wave of COVID. During that time, lockdown and everything was happening, and it got worsen and worsen later. Um, so I have asked her, what are you so scared of? So, like anybody else, she also Googled her symptoms and everything, read so much about her condition, and so got so scared about it that she is going to die soon, kind of a thing she has developed. So, okay, I told her, okay, let us face, if at all, such uncertainty happens also. So what do you think about it? Let us face the condition. Okay. Then she told me that she is worried about her son. So I told her, if at all, because see, nobody can say that, how long a person is going to live, but you have your family to support, you have your husband is there. Then, when, she was not talking at all about anything, then I have asked her, what is that thing bothering you? Just open up. Usually people would have trust in their parents, and in the spouse, right? So she was having some trust issues with the parents. What happened was when she was a small child, they went to a family gathering. Some function was happening there, and there happens one of her uncles have held her so tight, groped her. They were all cousins playing, but in the open only he was trying to hold her, tightly. She thought, okay, some elder person could come and maybe she can get out of the situation. And suddenly the mom comes there, and she started questioning, like, what are you been doing here? Kind of a thing. So she was playing with the cousins. Cousins were there next to her, but her mother was, questioning her rather than questioning the other person. And that's when she developed the trust issue. And even before and after also, whenever she asked something, she was not getting much help from anyone. So she has developed a pattern that whatever things are there in her life, she will be doing all by herself. She will never ask anybody, never trust anybody for that. Even post marriage also, in the very initial phase, she has to deal everything all by herself. So that also has, contributed to not having much trust in the partner, though he is very supportive and good. So this is what we have understood so far. So coming to her internal well-being, so what I asked her, what are you doing, to find some peace or some relaxation? She told me that she is into some spiritual practices, puja and all, everything. She was doing some mantra chanting and all. That is what, giving her some peace. So, okay, so far we have understood her story and everything. Then I was trying to understand what could be the connection between this condition and her mental state. So, while I was, just casually searching for some spices, very interestingly, I found this connection happening. So we all know that we all love biryani and we love cooking biryani. So one of the major ingredient in that is patthar ka phool, that is called stone flower. And while searching for it, I also came to know that it also belongs to a lichen family. So there I got to know, okay, this is also lichen and this is lichen. So what is it exactly? So I started studying deeper about it. Then I found it is a symbiotic relationship between an algae and fungi. So what algae does is it secretes oxalic acid to dissolve the stones and to get the minerals out of it. And it also supplies these minerals to the fungi, and fungi also supports the growth of algae in return. So that's how they break the rocks into the soil, and they also help in soil formation. So here in this condition, since she was going through a lot of stress, the cortisol levels were so high in her body. The cortisol was the breaking the barrier. I mean, the skin is usually a protective barrier for our body. So whenever there is a high cortisol levels in the body, it breaks the collagen in your skin. It makes the skin so thin, and uh, and that's how maybe she has got this lichen planus. And whenever there was an emotional outburst or something was there, she used to just sleep for at least 2 to 3 days. She doesn't even have any energy to get up and do any work in the house, because already a lot of adrenal fatigue she was going through, because the body has already pumped in so much of cortisol, and she has no cortisol or any stress hormone left to cope up with small things in day to day life. So that is one thing. And to come out of this situation, I have asked her to do the breath work, okay? Because she was constantly having rushing thoughts in her mind. To calm herself, I have asked her to do breath work, but that also she was not able to do. So box breathing is one thing I have told her, and I asked her to do some deep breath work and blowing the while exhaling, she has to blow to her finger so that she will feel the inhale and exhale as well. So, by deep breathing, it not just only reduces the stress and cortisol levels, but it also oxygenates your blood, and thereby the skin repair would also happen. And that's how breathwork helps in this condition. And have also asked her to write some affirmations for herself, that that she is safe, that whatever the incident happened that has happened when during her childhood, now she is safe and she can take care of herself, and she can release her fears. Okay. And she is in complete trust with the process of her life, and she loves herself. So these affirmations I have given her. So she religiously followed these. Whenever there is a negative thought coming, she has always practiced these affirmation back to back, and it also helped her to take control of her emotions, and the positive self talk has also improved. And apart from that, I have asked her, how was her routine and everything, but she doesn't had any set pattern routine as such. So I asked her to keep it very simple. Get up in the morning, write only 5 things that you want to do, so that and keep doing those 5 things, regularly without any fail. So that would, keep her in track. That is one thing I have asked her. And sun gazing is one thing, early in the morning and in the evening, because exposure to sun will also lift your mood. So that is one more thing that I have asked her to do. And she loves to dance, and she loves music. So I have asked her to play some good music in the home, and dance her heart out, so that the movement, whenever there is a movement, the body and mind coordination will happen. So whenever somebody is doing some activity with their hands and feet, so they cannot think about any other thing. For example, the driving is there, for example, some artwork is happening, they would be focused on that work, not on the stressful moment. So I have asked her to do dance regularly. And I have asked her also to organize her home daily, to clean small areas, to declutter and organize, so that an organized home will, cause little less stress to her. And also like taking some antioxidant rich foods, because she was not so keen with cooking or anything. So I have asked her to eat a lot of fruits which will be readily available, and she can just grab some fruit and eat on the go. So these are all the small modifications that I have suggested her. Since she is an investor, so the SWOT analysis has really helped her to understand it in a better way. SWOT is nothing but identifying her strengths and weaknesses, looking for opportunities and threats. Okay, so I this is what her suggestions are that I have given to her. Yeah. So finally, she has understood that happiness is something which we need to seek from within and not from outside. Yeah. Yeah. Thank you so much. That's all with the presentation for today. Yeah. Am I audible, by the way? I'm finished.
Yes, yes.
Sorry. So yeah, I'm open for the questions.
It was really a nice presentation, Soumya. I mean, I have heard this condition for the first time. That is one thing. And second thing I wanted to ask was how is it like? So, so what is it like? It is some kind of an algae, or what exactly is causing that problem? Because and how does it actually look physically? So I want to know because there's one of my client who is also complaining of an itchy and skin patches. So I just wanted to know if it's that is also similar.
For It is, ma'am, because I have got to learn that it is autoimmune and it is not an autoimmune also. Um, because the lesions were like mostly flat, and they were the texture was like sandy kind of a thing. That's what she has explained me. Okay, if at all you go just and rub on the surface of the rock, how do you feel that
Mhm.
powdery texture?
Mhm.
That's how it is. And the itch was sometimes very severe, that if at all she's doing any scratch or something, immediately her skin used to bleed, you know
Hmm.
and that's how it was. I mean, wherever the lesions are there, the skin will be very thin. So that's the thing she explained.
Hmm.
Yeah, I thought of adding some images, but it's gross. So
Uh-huh. Okay, okay. Okay. I'll get in touch with you once I get pictures
yeah,
from my
yeah,
client
sure,
also.
sure, ma'am.
Okay, thanks a lot.
Yeah.
Now, how is she feeling, ma'am? All her lesions, did it disappear?
Yeah, it took almost, ma'am, 1 year. She came to us in 23, I guess.
Okay.
It took a lot of time because usually in skin conditions, the recovery is not that fast.
Mhm.
Since she was in lot of stress, it is always related to the GI issue as well. Na?
Okay.
So we haven't given much of intervention with diet or something. I keep it very simple, like regular eating of fruits and vegetables. I have just focused on that one point. Yeah.
Okay.
Yeah.
Thanks.
More questions or
Ma'am,
yeah,
For oh, sorry. Go ahead.
yeah, please go
ma'am,
ahead.
has
Yeah.
she recovered with only the diet or with the diet and medication both?
Yeah, this is one more good point. Actually, she was very skeptical to use the medications because she was so scared that I'm at having a lot of side effects. So I told her use the medications for this moment, because she was not at all having good state of mind. First of all, her stress is only making the things very worse for her. So I told her to take the medications and along with that follow these things. So by 3 months, she was able to feel good about herself. That she told me that her anxiety levels have come down. She is able to be normal, but once in a while she used to feel that restlessness and all that was coming back. But since she so got used to with the breath work and everything, she was continuing that in between whenever she was having those episodes of anxiety or panic attacks. Yeah, with the medications she hardly used for 3 months, I guess. Later on, it was all the breath work, the affirmations. Only one thing, because I told you, right, like she was getting back to back very negative thoughts. I have told her to turn those negative thoughts into positive things. That is how affirmations, played the role there. Yeah,
Okay, ma'am, thank you.
yeah.
Uh, First of all, congratulations, Soumya. It's a like really nice job you have done. And the thing is, I have heard of this also for the first time, Lichen Planus. But the thing with skin conditions is, if you go to a doctor, a skin specialist, they will either give you like topical creams or steroids, but that also of not much of a help, And my brother is also dealing with some skin conditions, but he doesn't believe in all this, natural practices and all. But from this we can learn like simple practices like breath work and gratitude can play a major role in
Yes.
this, so it's a very nice thing. And can you tell me one more time, like that patthar ke phool, what you told, how you like suggested her to use that to help in her condition? I didn't get that.
No, no, no. While I was, because even for me also, this condition is very new. So when I was searching for the condition, not just for the condition, actually in general, I was searching for some spices. Okay.
Okay.
Then
Hmm.
one of the spice that we use in biryani is pattar ka phool. Okay.
Okay.
The scientific name, there is some scientific name was there, and it also belongs to the lichen family.
Okay. Mm.
Then there is also I'm looking lichen, and here in this condition also the lichen
Mm.
is same.
Mm.
So picking up these two words, I started to understand. Okay, it is not just in the only not just for humans. I mean, this is seen in the plants on the rocks also. So then I
Mhm.
started my self study as what lichen is all about. Then I
Okay.
understood, okay, it is a symbiotic relationship between an algae, cyanobacteria, and
Uh,
fungi. So what the algae does is, because on a rock it doesn't has any medium to grow, right? The
yeah.
algae releases oxalic acid on the rocks,
Okay. Okay.
and that oxalic acid it dissolves the minerals from the rock, and which this algae picks up. Okay,
Okay.
and this algae also supports the growth of fungi. Together, they have a symbiotic relationship.
Okay.
The same thing I was also thinking, what could be the reason here?
Mm.
So since their algae was trying to dissolve the rock here, since she was having lot of stress, the
Mm.
cortisol in her body was damaging the collagen, which is the supporting
Okay.
thing in the
Mm.
skin.
Mm.
Collagen
Mm.
is very helpful to keep the skin, maintain the skin
Yeah.
barrier, as well as to support and give it a shape. So here the collagen is damaged. So thereby the protective barrier, whatever is there in the skin, which is also damaged, right? And the skin is exposed to so much more. And
Mm.
on top
Mm.
of it, whenever the cortisol is high, she was also getting frequent infections like, what do you say, cold and kind of a thing. Okay.
Yeah.
So she
So
also,
there's also a dysbiosis, right?
yeah, gut dysbiosis
Yeah.
because of stress also. So whenever she went to, this dermatologist, she was given this steroid ointments and
Yeah.
everything. They are very
Yeah.
small in size, but they're very
Mm-hmm.
pricey and very expensive to solve. Um, yeah, I think Dagad pool or something used in biryani. Yeah. So that's how I came to know, the
Yeah.
link. That's how I correlated, I would say. Yeah.
Mm-hmm. Okay. Truly wonderful. Congratulations
Thank you.
once again.
Thank you. Any more questions or any suggestions from your end, coaches, please?
Good evening, ma'am. I have a question, ma'am.
Yes, yeah.
Firstly, it's a wonderful case study, ma'am, and it's very new case presentation, especially for beginners. Ma'am,
Thank you.
you told your client is having like psychological threat that she
Mm.
might end
Mm.
up her life. Is it like is this condition really life threatening or it's just
No,
a
no, no.
psychological tendency, ma'am?
No, actually, she has also developed some lesions on her lips and all. I told you, right? So she went to the doctor, and in front of the doctor, she broke down. Like, is it going to cause any cancers or something like that? The doctor told her, it is very rare. Even if a person has a lichen planus, not necessary that everybody or every case would turn into cancer or something. Only hardly a 2% people might, you know, get into that. So she was keeping all that stress in her mind and making her life so miserable. As such, it is not that serious. It can be controlled. Stress is a stress. Whenever she was stressed, there was a serious flare up was there. She used to get a lot of itching and all. So stress management was the main priority, I can say. Yeah.
What stage it's there, ma'am? Like there are stages in this case, ma'am.
She was in very initial stage only.
Okay, ma'am.
Yeah.
Thank you, ma'am.
Yeah.